Hello, everyone. I am giving the lecture on reporting. So, verbal reporting and documentation are two ways in which communication takes place among members of the healthcare team. Both are an account of what has been assessed or observed about a client and the care that has been implemented. Healthcare team members rely on reports and records to deliver care that is directly towards mutually agreed goals. Continuity of care and the pursuit of common objectives depend upon effective communication between members of the healthcare team, which involves accurate and precise verbal and written reporting and recording of information. Okay, the purpose of documentation is to facilitate optimal client outcomes through communicating accurate, objective, and contemporaneous descriptions of clients' health, status, and ongoing care. Documentation completed through professional and accurate writing with legislative and ethical requirements in mind helps to ensure that continuity of care is provided. Um, Let me see. All clients require documentation, which includes records of assessment, diagnosis, planned interventions, and subsequent care and evaluations. So, right there, you can see where it says the purpose of reporting is to communicate specific information to an individual or a group of individuals. It should be concise, oral, or written, which means that you shouldn't have like a long, drawn out thing. You should just give them the basic points, and it should be pertinent information. No out of the realm of what you're talking about, additional details. So, when you do a handoff communication, um, that means that you're handing off to the next shift, or you are transferring a patient to another floor or something like that. And they are records so that the people can promote continuity of care. And they are the means by which various members of the healthcare team communicate information about the client's condition and the type of care that has been implemented by the healthcare team. Written records, which are progress notes, provide permanent and accurate assessment of clients, their health status, and their progress going forward, and the data necessary to plan and implement care. As part of quality assurance programs, healthcare agencies perform audits in which the information contained in the client's records is reviewed on a regular basis. Audits are performed to determine the degree to which specified quality assurance standards have been met. So, hospitals are required to have a standardized approach. Ineffective communication is the primary cause of what they call sentinel events. So, mistakes and uh, death, various things that happen. Serious unexpected events may result in death. So when you transfer of information, you transfer between units, change a shift, and as well when you discharge. So we're gonna leave from that, and I'm gonna play you a nice little video, a YouTube video, and we're gonna show you a very funny video on the types of nurses giving report. And so I'm asking you, are you going to be one of these types? 2-minute video or so.
Oh my gosh, you know my patients? Patients, amazing. Families, amazing. No, everything was super great. It was super easy. You are going to have an amazing shift. You're here for a report. Hang on one second. I'm going to write I'm on the phone lab. I got to finish writing real quick, and then we'll be able to get started. Okay? You want to go get settled first, and then come back, and then I'll give you a report? I'm not ready. No, seriously, like, I'll come and get you. I just want to tell you what happened this morning. So I was almost late. It was because the freaking Starbucks drive-thru. I mean, like, you never know how long the line's going to be. But anyways, the person in front of me, I guess, paid to like pass it along or something. I was confused, and they asked me, did I want to pay for the person behind me? But I was like, oh my gosh, I got so stressed, I just spit it. So then I got to work, and then six, such a doll. I mean, such an amazing patient who actually went and grew up in the same like hometown, with the same high school. But I think she's closer to your age than mine. I'm not sure how old you are. She knows the subway. She was telling me a story about the subway that I was working at when I was in high school and stuff. So it was really cool because yeah, I used to be a sandwich artist and everything. We have room four. We have room four together. Okay, yeah, that's right. That was that 58. There was that 36-year-old male. Yeah, he's the one that you had the other night that had the IV. It was what was it? His left arm. It was the right arm. That's right. Okay, let me just get settled real quick and just review, and then I'll be able to give you a report. I'm sorry. The shit sucked like so bad. This is like the hardest shit I've had like this week. Number one, they gave me the hardest assignment, and I know it's because I'm the most experienced here, but it's like really again. And then let me just start off with the parking. Like good luck finding parking around here. I was like almost late, and then the cafeteria did not have the pizza hut ready for me. And then the tube station was down, so I had to run to and from lab. Like whenever I deliver something, I got so many steps, and then Epic was down, which is like crazy. I had a hand right, like hand chart, like it's the 1800s or something. Hello, this is IT. Yep, I guess I have to reset my password. Oh, do you know where my report sheet is? Oh, perfect, thank you. Hang on one second. I think it's my pen. Oh, is it? That was mine. Who had my pen? Do you know who had? She had my pen? Oh no, hang on one second. Can you look for my water bottle maybe? And just hey, you're back again? Okay, so you have 4 through 8? Okay, perfect, no changes.
So,
Hey,
uh,
oh my god.
that is just very, the video, I just found it to be funny because there's been times when I have worked and I have seen all of these types of nurses, the complainer, the people who talk really, really fast and you're like trying to slow them down, the person that's disorganized and don't have, um, all their things together. And as nurses, I just want you guys to remember to make sure that you always, always, always give a concise report, right to the point. And that's when we'll go into, SBAR, and that will basically keep you on track. So the key component to effective communication would be patient safety, healthcare quality, and patient outcomes. So you want all of those things to be into play. So you can give reports various types of ways. They do have types of reports. You got written reports, um, taped reports, verbal face to face in a private setting, and then verbal face to face in a bedside setting. So, nurse bedside shift reports or handoffs has been defined in literature as a process of exchanging vital patient information, responsibility, and accountability between the off-going and oncoming coming nurses in an effort to ensure safe continuity of care and the delivery of best clinical practices. And I mentioned the different types of nursing reports, and there's pros and cons. Written reports, I mean, to me, you can like not understand what somebody's writing and get the wrong type of information, um, as well as taped reports. I remember back when I started out of nursing school, and that was like in the 80s. A lot of you guys probably weren't even born. Um, I was out of nursing school, and they used to tape from shift to shift. I don't know how many times, you guys, when the tape would basically be like they taped over somebody, or the tape was accidentally erased, or and you're basically starting like with no information. Then, even though tape reports may save time or whatever, but you have to really, really, really make sure that you are actually taping the information. And one good thing about tape reports, you can stop them, you can roll them back, and you can listen to them. Verbal face-to-face reports in a private setting, that's a good idea because you're not um, impeding on a person's privacy, or nobody's listening to what you're talking about. You're adhering to like HIPAA guidelines and that type of thing. um, that can be okay, but you can't see the patient. I do like verbal face to face in the bedside setting, or right outside the patient's doors. You can talk and give information to about the patient, and the patient can interject. Some patients tend to feel uncomfortable with that, because when you're giving report, it's like you're not looking at the patient. Or sometimes I know, like for instance, when a doctor makes rounds, they're just like spewing out things about the patient, and it's a bunch of people standing there, and it could be kind of, um, I guess you could say, threatening towards, feeling from the patient, or they're feeling like they're a number and they're just sitting there in the bed. So you can take that type of stuff into consideration as far as, various types of reporting. Telephone communication. Telephone communication um, has to be precise and clear. And most of the time, that is being given when there's some type of change of status with a patient. And maybe a healthcare person may be calling a physician because there was a change in a patient's um, how they was progressing through the night, or they saw something wrong, and then you getting orders over the phone. Another thing is that a lot of times when there's a transfer from another unit to that unit, a nurse can give a report via telephone to the uh, unit that's receiving the patient, you know. So I would say the RN should write the complete order down if they're doing it to get an order from a physician, and they need to verbally repeat back the order to ensure accuracy. And it's always a great thing to identify who you are, and even if you have to spell your name out if necessary, and then you go as far as, with the reporting and stuff like that, you just use the S bar, which we're going to speak on that in a second. Okay, so with that being said, there of course are guidelines for good reporting. Fact: information about client and their care must be factual. A record should contain descriptive, objective information about what a nurse sees, hears, feels, and smells. So when they say the information should be factual, or they should be objective, that means that you don't give your opinion, you give exactly what you see. You won't say, oh, this patient was grumpy. Okay, you may say the patient was grimacing, or the patient said this or said that. You don't say, uh, like what your opinion is of the patient. It needs to be accurate, and the information must be accurate so that the health team members have confidence in it. Completeness. The information within a record or report should be complete, containing concise and thorough information about a client's care, concise data, and also it should be easy to understand. Current. Ongoing decisions about care must be based on currently reported information at the time of occurrence, include the following. So you're going to give the latest vital signs, any medication treatments that's pertinent, preparation for a diagnostic test or surgery, any change in status, a mission transfer, discharge, or even death of a client, and treatment for a sudden change in status. Organization, the nurse communicates in a logical format or order, and confidentiality. A confidential communication is information given by one person to another with trust and confidence that such information will not be disclosed. So, what we're going to use is the SBAR technique. The SBAR technique is an older technique, which is still even current today. And it's a wonderful, wonderful way for you to keep yourself on track when you're giving report. So you will report with situation, background, assessment, and recommendation. Situation, background, assessment, and recommendation. And that creates team cohesion and a culture of safety. The situation, let me give you a description. Situation is a concise statement of what the problem is. The patient came in with um uh the patient came in with a chest pain. Background, the patient has had a history of two MIs. um the patient is um took two nitroglycerin tablets with no relief. And then you go into the assessment. The assessment will be the vital signs and various things that is going on with the patient. And you would say any considerations of options and what you found and think. And then, of course, the recommendation. And that's what you request to be done and recommend uh, for that particular patient care based on what your assessment is. Now, sometimes with physicians, they may not choose to do what you say, or they may say, well, we need to do that, and then we need to do this as well. So that's a very important thing. SBAR, when to use the SBAR. Communicating with providers, you can use the SBAR. Uh, Doing shift change, like I said, handoff report, or when escalating a concern, when calling a rapid response, and the list goes on. It is for accurate and concise communication. Always think about accurate and concise. So you're going to identify yourself. You're going to identify the facility, the unit, and the patient. What is currently going on with the patient? Why are you calling? And make sure you're brief, as far as the situation, background. What is the clinical background or context related to the reason why the person came on, which is their situation? What does this provider need to know to treat and or answer your question about the patient? And remember, this provider may have never seen the patient before. Like it could be a physician that's on call, so you're going to have to give them as much background as you possibly can. include pertinent information, it may include things like the current diagnosis, current medications, allergy, IV fluids, lab results, as well as code status. What do you think the problem is? And support with any objective or subjective data. Subjective being what the patient says, and any objective data like labs that you've and vital signs and what you saw, and then what you recommend and what do you need from the patient. So that is your standard SBAR and how you will go about it. So from this point on, what we're going to do is we're going to practice. And you guys, these are just, if we were in class, this would be like us really working together and probably having a lot of fun with it and going through all these scenarios. And you guys, we would take it from there. So, with each scenario, I want you guys to draw like situation, background, assessment, and recommendation. And after you read this, I want you to pause right here on scenario one. And then I want you to fill out on side the situation what you would put the situation is. Keep it concise, what their background is related to why they came in, what the assessment is as well, and then what your recommendation. Okay, so scenario one, let's read it. Clarify an order. Okay, so that's what you're doing. Okay, Mr. Snape was admitted through the ED with right sided chest pain and difficulty breathing. The nurse completed a respiratory assessment and found his respirations to be shallow and 22 breaths per minute. Mr. Snape had an oxygen saturation of 89%. He was ordered 2 liters of oxygen via nasal cannula. Mr. Snape continues to have respiratory difficulties using SBAR. How should the nurse contact the physician to clarify the order? Okay, so what you're going to do is you're going to pause, you guys. All right, and then we're going to see if you got close to what, based on what the scenario was, did you answer any of the questions right. Now, I do know that you guys are first semester students, and you may not have known or know, you may know the basics as far as how many breaths per minute, if it's shallow, right sided chest pain. But I want you to take the time and I want you to look these things up. And he was at 89% oxygen saturation. Is that normal saturation? He was ordered 2 liters of oxygen via nasal cannula. Okay, nasal cannulas when they has the little prongs, and they usually put people on that. And then I want you to you're calling to clarify the order. So we would stop and then we would go on to the next slide. So pause right here, you guys. Try to see if you can fill it out. uh and then let's move on. Okay. Okay, now, Um, Miss, okay, so you got the situation, and then you're calling because you're clarifying an order. Dr. X, this is you in the ED at, remember you told your location. I have an order for oxygen via nasal cannula from Mr. Snape in room whatever. He is experiencing respiratory difficulty, and I want to clarify the order for you. Okay. Now, you're going to tell them that you had the 2 liters and stuff. Okay, you're going to give the background. Mr. Snape came into the ED with right-sided chest pain and difficulty breathing. Assessment: Mr. Snape is presenting with dyspnea, shallow respirations at 22 breaths per minute, and an O2 saturation of 90%. I think the orders, because you're the recommendation, I think the order should be changed to 4 liters per minute using humidification. Can I get an order for the increased oxygen? And I will repeat his respiratory assessment in 30 minutes. So you're asking the doctor what you think may help. And chances are, if you sound like you know what you're talking about, they will do these things for you, and they will keep it like it's supposed to be. All right. So that is you using the S bar for this particular scenario. How many of you guys got it kind of close? But if you have any questions, feel free, to contact us about each scenario and let us know. And up here, like the situation, I would have been real specific with the 2 liters, before I would have asked to increase it to 4 liters. But that is, what the situations call for. So let's go to scenario number 2. Okay. Remember what I told you guys. Make sure you pause it. And you will find that if you pause it and you do it like you're supposed to do it, this would take up your complete class time. Scenario 2: report a change in condition. Mr. Flitwick was admitted to the medical surgical floor 2 days ago. 2 days ago, you guys, for hip surgery, and has been going in and out of controlled AFib since his surgery with a heart rate in the 90s. Mr. Jones has a history of AFib and was on Coumadin with 5 milligrams every day and Lanoxin or digoxin 0.25 milligrams Q day prior to the hip replacement. He has not had any of these medications since the surgery. That's an important thing. This morning, Mr. Jones has gone into uncontrolled AFib with a heart rate of 120 to 130, you guys. He is currently asymptomatic and his vitals are stable with a blood pressure of 120 over 80, temperature 98.2, and respiration 16. He is resting comfortably in his room. How would you use SPOR to report the change in condition? Okay, pause here, you guys. And then what you do is you start figuring it out. Now, like I said, a lot of you guys probably are not familiar. What I would want you to do is going in and out of, okay, you, first of all, look up hip surgery, post hip surgery. What type of things do they give a person post hip surgery? Okay, that's what you need to look up because Coumadin is a blood thinner. They're saying that he is on no medication since his surgery. He was on Lanoxin. I've seen this type of thing happen before where post-op orders come and they do not reorder the patient's medicines that they was on previously or tweak them so that they could go along. He may be on Lovenox or something like that. That's another blood thinner, but I want you to look up what Coumadin is for, and I want you to look up what digoxin is for. I want you to find out complications of hip surgery, um, and you got most of the vital signs and stuff, and he's asymptomatic, but the heart rate is 120 to 130. I wondered why. Look at the Lenoxin and find out what the Lenoxin is supposed to do. He is currently resting, respiration 16. So here's your situation, background assessment, recommendation. I told you guys to put it on pause, and I want you to work together or work by yourself or however you're listening to this. And I want you to try to put something together before you advance. So put it on pause and do this now. Okay? All right. However long it took you that you was on pause, we're going to move on to the answers. Situation. Dr. X. This is Nurse Z from Med Surge at Blue Blue Blue. I am caring for Mr. Flitwick in room Blue Blue Blue. Mr. Flitwick has changed in his heart rhythm. Mr. Flitwick had his hip surgery 2 days ago and has been going in and out of controlled AFib since his surgery. With rates as high 90s, Mr. Jones has a history of AFib and was on Coumadin and Lenoxin 0.25 milligrams prior to his hip replacement. I mean digoxin, but Lenoxin and digoxin is the same med. He has not had any digoxin or Coumadin since his surgery. This morning, because you're giving your assessment, Mr. Jones has gone into uncontrolled AFib with a rate in the 120s and 130 range. Is that a normal uh, pulse range or apical pulse range? Is that rate normal? No, it's not. He is currently asymptomatic and his vital signs are stable and they're given the blood pressure result. He is resting comfortably in his room. That's your way of letting the doctor know he's not, diaphoretic, he's not short of breath, he's not passed out, he's just sitting there. But we want to do something about this right now based on his vital signs, based on I realized the fact that he hasn't been taking any medicine. I think that a 12, and then your recommendation is, I think that a 12 lead, that's a EKG, should be ordered for Mr. Flitwick. Would you like his digoxin or his Coumadin to resume? Or are there any other tests you would like to order? I will call you if Mr. Jones converts or becomes symptomatic. Would you like me to call you with any other information? That is how you give a report. Doctors sometimes get kind of nasty if they seem like you don't know what you're doing. So it's going to take some practice. Some doctors don't, some do, and you'll kind of learn that as work more, as you practice nursing and that type of thing. But it's going to take time because you're going to be a new nurse, and but I want you guys to use your resources, which mean people, and uh be able to look up symptoms. And that's all goes back to like critical thinking and how you manage your time and manage your situation, and you being astute enough to recognize when something is not correct. You may not know why, but you just know that it's not correct. So it's your job to give them as much information as you possibly can. Okay, so let's go on. Next scenario. And I want to let you guys know that I think there's a total of, if I'm not mistaken, there's a total of like 5 scenarios that you need to work through. And I would tell you, please, 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 we will be doing this in class, but I want you guys to really, really work on this, and work it through so that we can just briefly discuss next week what what it is. Okay, and how you guys made out on it. Okay, so scenario number three, Mr. Weasley is a 22-year-old who had surgical repair of a fractured ankle 2 days ago. When you look at you guys and people are having bones and that type of things, they are at real risk of having blood clots and stuff, especially pulmonary embolisms when you have hip surgery and things like that. And so I would say look up what is the main complication. When they have a complication, what is the symptoms, and just kind of get used to that. And the more you do that, the more you'll know and you'll feel comfortable in your assessment. So 22, young person who had surgical repair of a fractured ankle 2 days ago. Okay, he has had very minimal pain control since his surgery. He is refusing to ambulate and is even hesitant to move from his bed to his chair. Okay, this is his first time having any surgery. He has an order for Tylenol for minimal to moderate pain and morphine for severe pain. He is currently ranking his pain 9 out of 10 with a short quality and rating to his mid calf. His pedal pulses, which is the pulses in that particular foot up above dorsal area of the foot, are equal. The surgical site is clean, dry, and intact, and his vitals are stable. Temperature 98, rest rate, yeah, blood pressure 115. Using SBOR, how would you address getting an order for improved pain coverage? Because here they're saying he has had very minimal pain control. He's telling you his pain level is 9 out of 10. Okay? And that was 2 days ago. So there's no improvement. Okay. You guys, think about what we said. Think about everything we've taught you about pain and pain control and you being judgmental and you know what I'm saying? People maybe possibly withholding meds, this person being young, people, just various things. Some people perception is more for pain than what you may think it should be, but that's not your decision to make. So, what you need to do is do your S board. So, I'm gonna want you guys to pause the video and based on what you see on this screen, do your S board. Okay. Okay. I hope that you paused and you worked on your S bar. Okay, Mr. Weasley, we did all this. Y'all know what the situation is. Situation. Hello, this is Nurse Blank from Med Surge at this. I'm caring for Mr. Weasley in room this. I'm calling regarding his pain control. Okay, so the background. So you gave them the situation. Where are you calling? Who you are? You identified yourself. Mr. Weasley is a 22-year-old who had a surgical repair of a fractured ankle 2 days ago. And then you're telling them he has minimal pain control. He has an order for this. He's had this order for morphine. He does not have any allergies. This is his first time having any type of surgery. That or significant injury, which is a big deal. Because sometimes if people are not used to that type of thing or ever been in that type of predicament, they flip out. So you telling them objectively, not subjectively, but based on what the person tells you subjectively, you're saying 9 out of 10. and you're describing the pain, PQRSTU, and how it's doing. It's radiating. He is reluctant to ambulate, even refusing to get out of the chair. They, you saying the pedal pulses are good, so there's circulation and how the vital signs and everything is. And then you say, I think Mr. Weasley would benefit from some longer lasting pain medications. What would you prefer to order? Are there any exams or labs you would like to order regarding the calf pain? What should I call you for in the future regarding his pain control? So you're asking for some type of direction. And that is a good S bar. Okay, moving on. Scenario 4, Mrs. Granger, a 55-year-old woman, recently admitted who looks pale and sweaty, you guys. She says she feels confused and weak with complaints of chest pressure. She was admitted a few hours ago with severe anemia and has already received 2 units of packed red blood cells for her anemia. Her current vital signs are 90 over 50, heart rate 120, respirations 24, temp 99, and O2 92 on room air. Emission hemoglobin was 6, and 3 hours ago was 6.4. She has a history of GI bleed and heart disease. Okay. If it's something on here that you don't understand, you guys, like if you don't understand, look up what the normal range of a hemoglobin is supposed to be. Okay. Look up um she's pale and sweaty, confused, chest pressure, severe anemia she had. She didn't had packed red blood cells. All of that kind of stuff is significant and her history as well. So pause the tape, you guys. Pause the tape and work on your SBAR, your S bar, and then come back and see if you did it correctly. Okay, the situation. And then you call. Good evening. This is X nurse on med surge at X. I'm calling about Mrs. Granger in room this regarding a possible bleed and chest pain. Miss Granger is this age, anemia. You gave the lab results, you know, and has received packed red blood cells. You told them everything about the background so that they got something to go on. You did the assessment. You told them she's pale and sweaty. You told them what her blood pressure and her heart rate was, which is significant. She is also complaining of chest tightening. I believe she's actively bleeding, but I cannot rule out an MI. I would like to get an EKG and a repeat H&H, and I need you to evaluate her right away. That is a wonderful ESPO, okay? Based on this woman's situation, based on her background that you already knew. She has a history of GI bleed and heart disease. Okay, so if you got close to that, very good. Let's go on to our last scenario. Scenario number 5. Mrs. McGonagall is a 79-year-old woman. All of these things like age and that type of thing, that's significant. Um, that arrived to the ER from a skilled nursing facility. She does not have any allergies. She came to the emergency room. She was already in a SNF, a skilled nursing facility. She failed trying to get out of her bed and has been complaining of pain in her right hip. She has a history of dementia. She received morphine about 2 hours ago, which did relieve the pain. Her x ray shows a break of the hip. This happens to a lot of elderly people. Okay, you guys, her skin is intact and she is receiving normal saline in the left forearm. Find out normal saline. What does that do? It does. It's just like it's homogeneous. It's just like the consistency of your blood. It matches. Okay. Her vital signs are stable. She did receive the morphine. She got a broken hip. She has a history of dementia. She came from a sniff. Okay. All of that is information. Okay. Surgery is a possibility, but the surgeon has not confirmed this yet. You need to give report to the oncoming nurse at shift change. Okay, you guys, oncoming nurse. I want you to pause and I want you to write your situation, write your background assessment and recommendation. Okay? Okay. So pause the tape and write those things. Okay, next, this is what you should be reporting to the nurse. This patient, Mrs. McDonald, in room whatever room she's in, is a 79-year-old patient who arrived a few hours ago from her facility after a fall. You're being concise, you're telling them what her situation is. So already they know that she's in a skilled nursing facility. They know that she what room she's in, what her name is, how old she is, how long ago it was she came. Background. She has a history of dementia with no known allergies. Okay. A X-ray showed a broken right hip. On assessment, and then you tell them her skin is intact. This is your assessment. Vital signs are stable. She has no current complaints of pain, but did receive morphine 2 hours ago. Remember, she has dementia, so she may not really be telling you to the fullest what's going on. Some things you may have to assume. She has normal saline. A lot of times they put normal saline and they'll put it like just enough to keep the vein open in case they have to take her down to surgery. In her right arm, forearm, and there are no other abnormalities in her assessment. So you may have to tell how she's resting, how you got her. I would even tell them, what her pulses are. But her skin is intact and everything. What her movement at all, if it is any, is like. There is a possibility that she might have surgery in the morning, so she needs to be kept NPO tonight, which means nothing per oral cavity. That's what NPO, which means you don't give her nothing for food or drink, nothing per oral, nothing by mouth. I recommend updating the family when we know for sure if surgery will happen. And that is how you give a report. So, if anybody has any questions, feel free to reach out via email or anything like that. But I hope that you guys did do it like you were supposed to do it when I told you to pause and you keep practicing, and you'll know because you'll be going to clinical how to do a SBAR report. And I want you to watch the nurses and watch. Remember that little video that I showed you guys early on? Remember that video. What type of nurse are you going to be? How are you going to report? What type of things are you going to say? Okay, so that will be the end. Thank you guys, and you know, good luck. I hope everybody did well on their exam. Thank you very much.